Good morning, class.
Good morning, sir.
Oh, sir.
Okay. Uh, please, who is the course rep?
So I'm part of it. I've called you, but you're not picking. I thought,
Ah, you called me.
yes, sir. Mr. Sapon, or sir, it's not you.
No, no, no.
You are not called Mr.
I'm
Sapon.
not the one. Okay. My name is Dr. Atta Kwesiapia.
Okay. But and they gave
Uh-huh.
us a wrong name on the timetable.
Yes, yes, yes.
Okay,
Yes.
that's why.
Yeah.
That's why.
They told me last week, so.
Okay. I thought that's why the
No,
master was not picking. Yeah, okay.
yes. How many are you in class?
They are not away, so I'm giving an announcement now for them to join.
Okay.
Yeah, they thought there was no class.
Hey. Sorry. Because you were calling and you were not getting him.
Yeah.
But how many are you in class? Because only.
So we are almost 300. So at least 290 or 280 something. Yeah.
Hey, then you are many.
Yeah.
Please tell them to join. Uh-huh.
Hello, sir. And I was him.
Hello. Hello.
Hello, sir.
Yeah, Koso, what's your name?
Caleb.
Caleb. Okay.
Sir, I was asking that our timetable, we were supposed to meet us 4 to 6, but we just received a new one that's 9 to I don't know, 9 to 10, 9 to 11. So I don't know if it will be
Yes.
the same next week or next week we will change to
Yes.
4 to 6.
Now the time is going to be like this.
Like this.
For
Okay.
anatomy.
Yeah, okay.
The problem was that there was a crash. I'll be
Okay.
teaching about 3 different classes today.
Okay.
So they changed the time. So sorry they couldn't communicate to you earlier.
Okay.
So the anatomy one
Okay.
will be from 9:15 to
Okay. Okay.
11:15.
Okay.
Uh-huh.
Okay.
Okay.
Mm.
I hope yesterday you were able to have the physiology.
Yeah, we studied physiology yesterday.
Okay.
Yeah.
Okay. So what did you do in physiology yesterday?
Yeah, we started talking about the body. You don't know.
Okay. The class is 178 now. I don't know whether I can
We
start
are we are
because
talking about the cells and the tissues. I don't know, sir.
okay. So that
The
is
ones.
fine.
Okay.
Yeah,
179
so
now. 179, yeah.
yes.
I don't know.
So the class from now on will be 9:15.
Okay.
You
Okay.
realize that when I clicked the Zoom link, I saw that the time they, they scheduled it at 9:15.
Okay.
Actually, I'm not the one who controls the Zoom way.
Okay.
Mhm. Okay. So yesterday, how many attended the Zoom class, the physiology?
Almost 280. Yeah, we were 280, 70, 200.
Almost
Yeah.
almost almost 280.
Yeah.
Okay, but you are saying that the class is around 300.
No,
Okay.
we are around 290.
290. Okay.
Yeah.
That means almost everyone. Okay, but yesterday was Saturday. Today is Sunday. Probably some people want to go to church. So, based on the what happened, when do you think I can start? Now we have
Yeah.
186.
So I think you should start because it's more than half. Or we
Hmm.
should reach 200.
Okay, I think we can start because what we are
187.
going to do today, I think
187.
physiology lecturer. Hello.
Hello,
Please,
sir.
can you hear me well?
Yes, please, sir.
You can hear me?
Yes, sir.
Okay. Okay, thank you very much. My name is Dr. ATTA Apia. So if you just Kusi Apia, Kusi
Yes, sir.
Apia. Okay, so this semester I'll be teaching you Anatomy 1. Then maybe probably we'll do Anatomy 2 next semester. Now, the time will always be like today, Sunday, 9:15 to 11:15. Do you have the course outline?
No, sir, we don't have the course.
No, please.
You don't have the course outline.
Yes, sir.
Okay, so what usually our first meeting, I'm supposed to show you the course outline. So what I will do is that I'll send you the course outline. I think I can even project the course outline. So I'm going to do that so that you see what we'll be looking at this semester. So let me share the slides. Okay, so semester 1, the course title is Human Anatomy 1. And the course code is NURS 157. You know, anatomy and physiology, they go hand in hand. But then just like you in the senior high school where you have integrated different lecturers teaching the integrated science, that's how we do it also in the university. So when it comes to the recommended reading materials, in fact, it's the same book for anatomy and physiology. So you have Saladin, Anatomy and Physiology, the Unity of Form and Function, Essential of Anatomy and Physiology by Silla and Stevens, Textbook of Anatomy and Physiology by Sonny Pakanch. Then, of course, the popular works and Wilson Anatomy and Physiology in Health and Illness. So these 4 books are the recommended books. You can download them anytime. Now, so these are the things that we are supposed to do this semester. So this semester, we'll look at the structure and composition of a typical cell. We look at the different types of cells. Usually, the structure and composition of a typical cell and the different type of cells, the physiology lecturer will handle that because once he's done the cell membrane, you talk about membrane transport. So I think physiology lecturer will do that one. Then we have the various tissues in the body, the various organs of the body, and name the organ that they contain. We look at the various types of bones that make up the skeleton. We look at joints and muscles associated with them. We look at the various types of muscle tissues, the major muscles in the body, their position, point of origin and insertion. And of course, we look at the cardiovascular system. Then finally, the respiratory system. Then finally, the respiratory system. Then we also look at the lymphatic system. Of course, the cardiovascular system and the lymphatic system constitute this, the circulatory system. So these are the units divided into 10 units. So what I'll try to do is I'll attempt to probably complete each units per week. I have a plan on how to go about it. Today, we'll look at Unit 1, Unit 2, and Unit 5. And I think we can do those ones today. The organization of the human body, cell, tissue, organs, and system, anatomical position, directions, and plane. Then the cavities of the body, ventral and dorsal. So please, when you join the class, you mute. I don't want to mute the entire class. As when you want to, I think most of you want me to do it that way. So I muted all of you. What it means is that when you want to ask a question, you will not be able to do so. The best thing will be that I'll allow you to mute and unmute yourself so that if you have a question, you can just ask. But most of you, your microphone is always on. So when you talk on the background, it disturbs the class. But I think if you want to ask something, you can always raise your hands, or you can write a question down. When I'm done, then answer those questions. So today we'll look at Unit 1, Unit 2, and Unit 5. The structure of the cell and plasma membrane, I will discuss with your physiology lecturer, patient, and I'll tell her to handle that one. Okay, so let's start with our introduction to anatomy. One thing I also want to do is that although we have a very large class, I want you to talk because this one is introduction. You've done anatomy before because I know you are a diploma student, so you've done anatomy before. And of course, at the diploma level, you even use Ross and Wilson anatomy and physiology book. So you have a very good knowledge. So this one is just more or less a top up of the anatomy and physiology. But all they say about was Zoom that you haven't done anatomy before. But of course, if I ask a question, I really want answers. So let me share the slides and let's see and look at the introduction to anatomy. So these are our learning objectives for today. At the end of the study, you should be able to define anatomy and look at the subdiscipline. We'll look at the levels of organization in the human body and explain the interrelation between. Then we'll look at the organ system, look at anatomical position, anatomical terminology, body cavities, and some imaging techniques. Then finally, just an introduction to the medical imaging techniques. Then of course, we'll look at the word roots and anatomical terminology or medical terminologies. Okay, so what is anatomy? Can someone help us with anatomy? What's anatomy? Please, you can record yourself. I think the system is designed such that when I start recording. So whatever we are doing is being recorded. But I think if you really want something, you see, the lecture is going to be 2 hours. I'm not sure that when we are done, you have when we are done, you have time to actually listen to the 2-hour lectures. I mean, that one, I'm not sure. And you realize that this one, there will be so many things that may not be necessary. So if you really want to actually, maybe you're not able to attend class, or maybe you want to, the slides are there. You can just go through the slides. If you want a video, I think you can get a video from YouTube, which will last probably 30 minutes. I think it would be easier watching a video that is 30 minutes than trying to watch a video that is 2 hours, especially where there will be so much interaction. I'll be telling some to mute and all those things. Okay. But all the same, remember that everything is being recorded. So I'm excuse me. I'm allowing you to mute and unmute. So for those who have raised their hands, if they want to have a question, they can ask. Excuse me. Okay, so those who have raised their hands, they can ask whatever question that they have.
Sir.
Uh-huh.
Sir, please, how will the exam be? Will it be objective for a theory?
Okay, for anatomy and physiology, anatomy, I only said MCQ
Hello.
questions. It's only MCQ questions. But I think I also have to find out from the school. I also have to find out from the school because how the exam is going to be. Because when you have regular students, we normally do theory and practicals, but this one is Zoom. So I'm wondering how the practical is going to be. But then anatomy is MCQ. It's always MCQ. In the medical school where I teach, it's just MCQ. So I found out from the other lecturers how your case, how to resolve that one. Because for the regular, I know that it will be. I don't teach the regular but I teach the med lab students, and anatomy is MCQ, then the practicals. So I found out how this one in your case is done. But then it's going to be practical. It's going to be what they call it, MCQ. It's a practical aspect that I'm saying that I'll try to find out whether we can have maybe a practical style questions where you will, but then all they say to be something like an objective. But I found out. And you have between 140 to 150 MCQ. 140 to 150 MCQs within 2 hours. Any question again? Any question? Because when I start, I'm going to mute all of you. This one, no, this one I'm not going to mute because it's introduction. I want you to answer. Okay. So what is anatomy? Caleb, what is anatomy?
Sir,
Uh-huh.
he said, what's anatomy?
Yeah, what is anatomy?
Anatomy is the study of the human part, both the internal, the micro, and the outside part of the body. Organ.
Okay. Okay, so how is this different from physiology?
The physiology talks about the functions.
Okay.
More about the functions. So I wanted to ask some questions.
Yes, you can ask.
Are you going to write the anatomy and physiology exam together, or it will be different questions? Because
no, it's going to be different. It's going to be different.
okay. At nursing, it was joined together, so I thought at diploma level it was joined together. I thought.
Yeah. I understand how it was done. You see, the course code is different for anatomy, different from the course code for physiology.
Okay.
So I believe that you registered the two differently. So those ones will be separate papers.
Okay.
But the thing is that's why I explained that it's anatomy and physiology. But just like in a senior high school, You hardly get one lecture teaching all the aspects of integrated science.
Okay.
So here too, we do it that way. So you have someone who has done a master's in PhD in anatomy. So I handle anatomy. So then you have the physiology lecture also the same way. I mean, the only time I studied physiology was when I was in a university. So it's only anatomy that I teach. But for allied health students like nurses, medical lab, etc., the books are always, because the books are written in a systemic approach, so it's always anatomy and physiology. But then we have anatomy books. We have human anatomy books, and we also have human physiology books. But those ones are more detailed.
So
and
the
those
Wilson and
ones,
Williams, the Wilson books, is it anatomy or is both?
yeah, all the books that I showed you, they are all anatomy and physiology books.
Okay.
They are all anatomy and physiology books.
Okay.
I've downloaded the CODeL, the ATTA, the Essential of Anatomy and Physiology. So it's not going to be that detailed. I'll try as much as possible not to make the information plenty, because you realize that I only have, 2 hours to finish a particular topic. So if you respiratory system, I actually have to use 2 hours to finish it, because you don't have enough weeks. You don't have enough weeks, and I want to finish everything. Okay, so if you don't have any question, I think I can. So our gentleman told us what anatomy is. So in anatomy, what we do is that we study the body structures, and we're also interested in the relationship among them. So it's not so body structure, like Caleb said, both the internal and external. So like we can look at the external nose. At the same time, we can also look at the stomach. So if you're looking at the stomach, we are looking at the structure. So structure, we are looking at the size. We are looking at the form. Or okay, we are looking at when I say structure, it means the form. We are looking at the size. We are looking at the shape. We are looking at the location. Then we are looking at the relationship. In other words, what structure are in front, behind, on the medial and the lateral side of the stomach. So that's what anatomy is all about. We are looking at the body structure and the relationship about them. Okay. Because when you know the relationship, of course, and let's say there's a gunshot or someone stabbed, you will know the structures that will be affected, because you know the stomach and you know the structure that's behind it. And you also know the structure that is in front of it. Anatomy comes from the Greek word "ana," means up or through. Then what is it? 10 minutes, I don't know how to pronounce it, which means to cut. So anatomy means to cut up or to dissect. Of course, it's because in those days when anatomy started, they were more concerned, because the external features were obvious. They were more concerned about the internal structures. And of course, before you can study them, you have to cut up. In a medical school, we use cadavers to teach anatomy. And a cadaver is basically a dead body that we use to teach anatomy. And usually, how do we get those dead bodies? People sometimes donate their bodies. That this one they don't pay any, it's not paid, it's body donation. So I can say, okay, when I die, they should send my body to the KNUST University for anatomical studies.
Wow.
So the dead body that we use is what we are referring to as a cadaver. And then you dissect the cadaver. But you realize that after the dissection, you throw the cadaver again, and in other words, you bury them. But you see, you can't be getting cadavers every now and then when you are finished with the dissection, you bury them. So sometimes after the dissection, you preserve those ones. Then we use the dissected bodies to teach. And so that is what we call possession or protected bodies. So bodies that have been carefully dissected, and we use it to teach. When Caleb was talking, he was said that in the body structure, we are interested in the micro. He used the word micro and the micro aspect. So the main branches of anatomy are gross anatomy and microscopic anatomy. So in gross anatomy, we study anatomy using visible to the naked eyes. Whilst in microscopic anatomy, we look at structures too small to be seen with the naked eye. Sorry for the interruption. Too small to be seen with the naked eye. So in that case, we use microscope. And the microscopic anatomy, you can divide them into study of the cell, which is cytology, then study of tissues, which is histology. But of course, anytime you are talking about microscopic anatomy, we just say that it's histology. Because you can't study the tissues, we're also looking at the cells. In gross anatomy, where we look at structures visible to the naked eye, there are several approaches. You can have regional anatomy, systemic anatomy, clinical anatomy, surface anatomy, section anatomy, all these, even endoscopic or imaging anatomy, all these anatomy falls under gross anatomy. Now, most of the time, when you say anatomy, you are more or less talking about gross anatomy. So in common usage, the term anatomy usually refers to gross or microscopic anatomy. And in fact, the anatomy that I'll be teaching you, it's more of gross anatomy. There will be some little microscopic anatomy that I may have to do. Remember, you study microscopic anatomy using a microscope, and we will not get a chance to look at the structures under the microscope. But then it will make sense that when I'm teaching something like the stomach, under the digestive system, we have to understand we know that the stomach secretes gastric juice. So we have to know the cells that secrete gastric juice. We're able to identify those cells through microscope. So once I teach the stomach, for example, definitely I have to talk about the cells like the parietal cells and the chief cells and the role that they play. But then we are not going to have a slide, a section of the stomach, and we look at it under the microscope. Then we say, this one is the chief cell, this is the parietal cells. That one, we are not going to have that. That's why I'm saying that most of the anatomy will be gross anatomy, a little microscopic anatomy to help you appreciate some things. Then another main division on anatomy is developmental anatomy. Because we're also interested in the structural changes from conception through adulthood. So that one too is very, very important. But then so that's developmental anatomy. So you have the prenatal life and the postnatal life. We are not going to deal with the postnatal life. So we'll look at the structural changes from conception to the time that you are born. So that one will be embryology. So in a medical school, for example, for them, they don't have just anatomy and physiology book. They have gross anatomy book. They have microscopic anatomy book. Then they have embryology. they have embryology, where we look at the development from conception to the time of birth. But please let me clarify something here, or what an embryo is. Now, from the definition that I'm giving here, we are saying that embryology is the development before what, birth. I'm using this definition because the embryology books we teach from the point of fertilization and even gametogenesis to the time of birth. But then the term embryo actually refers to the conceptus before 8 weeks. So there is a term, there is a fetus, and there's an embryo. After 8 weeks, it's a fetus. And up to 8 weeks, it's an embryo. So it may mean that, okay, if you are talking about biology, then it means that you are studying the what? From conception up to the end of the 8 weeks. But I'm saying that we are not going to use that definition. So just know that in biology, we are looking at the structure changes to the time the person is born. So this one too, I'll talk about maybe one or two important developmental anomaly when I'm maybe for each of the topics. For example, if we are looking at the cardiovascular system, we'll have to talk about something about maybe who in heart. Yes, because fine, you see that in an adult, but then it has developmental heart origin. So there'll be also a little developmental anatomy that we'll talk about. There are other subspecialty for anatomy. You can have clinical anatomy where you use anatomical knowledge to clinical practice. And so you can look at, so that under clinical anatomy, you can have surgical anatomy, you can have radiographic anatomy. Now to the pathologists, yeah, we can have pathological anatomy where they look at the structural changes associated with disease. Now, you can also talk about surface anatomy. In other words, if you have to check the heart sounds, you know exactly where to place the stethoscope. Or if you want to take venous blood, you know exactly where the vessels are. So that one will fall under surface what? Anatomy. You can have forensic what? Anatomy. And for those doing imaging, normally the anatomy is kind of session anatomy because it has to conform with how the imaging is done. Okay. Now, a little history of anatomy. I'm not going to bore you with the history, but just know that before this one is BC, 3400 BC. That was the first time someone wrote anatomy what manual. So even before Jesus was around, people were learning what anatomy. There are two gentlemen that their names worth mentioning. One is Galen. You might have heard his name before. He was a very influential writer, well known in anatomy. In fact, most of the things that he said were used for more than 1,000 years. So this gentleman came in Vesalius. Vesalius is regarded as a father of anatomy because he featured most of the misconception of Galen. So he's the father of anatomy. He died in 1564. I think 15th October 1564. So every year, 15th October, we celebrate that day as the World's Anatomy Day. And that one in honor of Vesalius, who is the father of anatomy. Now, so let's look at the main thing. So we want to study the human body. We want to see the structure of the human body. I'm using the word human body in the sense that we also have plant anatomy. Yes, we also have plant anatomy. So here the emphasis is human anatomy. So we want to study the structure of the human body. But then how do we go about it? We know that everything is made up of matter, then of course atoms. So the best way to study the structure of the human body is actually to start from the chemical level. And that's why we do chemistry. So in fact, in the anatomy and physiology book, there will be a section on basic chemistry because the human body is basically made up of our chemicals. So you have something like, if you look at the chart here, hydrogen making up about 62%, oxygen, carbon 10%, nitrogen, and you have these other minerals. So whenever you are taking something into your body, it basically contains these things. And we know the atoms form molecules. And these are the major molecules that you have in the body: water, proteins, lipids, carbohydrates, and others. So these molecules, they form the organelles. And the organelles like the nucleus and the mitochondria, and these the organelles will make up what? The cell. So the second level of organization is the cellular what level. Then, and we have about 37.2 trillion cells on average. The human body contains approximately 37.2 trillion cells. This number depends on the age, the body size, and the health status of the person. Now, these trillions of cells, the similar cells come together to form what? Tissues. And in the human body, there are four main tissues. There is the epithelial tissue, there is a connective tissue, there is the nervous tissue, and the muscular tissue. So if you want to study the human body, apart from doing electrochemistry and also doing the cell structure, that is cell biology, you also have to study tissues, and that one will be what? Histology. Then we know that the different tissues come together to form what? Organs. The different organs working together will form what? A system. And the entire systems working together will form what? An organism. So if you want to study the human being, who is an organism, just like the bacteria too also is an organism, you can decide to start from the smaller units, which is the chemical level, then progress all the way. So you realize that in all the anatomy and physiology book, in the study of anatomy, we study it under a systemic approach, where we look at all the systems in the body. Because by learning the system, you will have learned all the organs, because systems are made up of organs. And tissues make up what? The organs. And of course, the tissues are made up of what? Cells, and the cells are made up of what? Chemicals. I'm not going to teach you basic chemistry, although in your anatomy and physiology book, they do a little about basic chemistry, but you've done chemistry, so I'm not going to teach that. Then of course, cellular level, as I said, I'll check with the physiology lecturer whether I should teach it or he would teach it. Usually, they are the best people to teach the cellular level because, for example, when they do their cell membrane, then they need also to do about membrane transport, where they talk about osmosis, diffusion, and active transport. So after the introduction to anatomy, the first thing that I will teach will be the tissues. So we're looking at 4 tissue types. Then when I am done, instead of doing the organs, of course, you can't be learning the organs in isolation. You can't say today you are looking at the heart, and the next day you are saying that you are looking at the stomach, and the next day you are looking at the bronchi. No, we are not going to do it that way. We are going to learn the organs based on in a systemic manner. So after the tissues, we look at what? The organ system. Please, can you okay, some people have been defining anatomy. I should have looked at it. Oh, okay, that's very nice. That's fantastic. Okay. Okay, so I'll be checking. Some people may not want to talk, they may want to type. So I'll be looking at your chat to see the answers that you'll be giving. Now, so let's look at the systems. Let's look at the systems. So can you tell me some of the systems that we have? You're mute, then you tell me. So in a system, so someone has said digestive system,
The nervous system.
the nervous
Respiratory
system,
system.
The
the
skeletal
respiratory,
system.
the skeletal system. Then I can
Cardiovascular
see
system.
I can see
The
integumentary
integumentary
system,
system.
cardiovascular system.
Digestive system.
Muscular
Respiratory
system.
system.
Yes, integumentary system. And I've seen
Reproductive
lymphatic
system.
system. I've seen
Reproductive
endocrine system.
system.
Okay, thank you. It looks like
Lymphatic system.
Respiratory
yeah,
Endocrine system.
it looks like you mentioned all the systems. I don't know whether if we have to count them. You said the integumentary system, one, skeletal system, two, I think no one mentioned the muscular system. So that would be three, the nervous system,
Endocrine.
four, endocrine system, five, cardiovascular system, six, the lymphatic system, seven, respiratory system, eight, digestive system, nine, urinary system, 10. Then of course the reproductive
Lymphatic
system will
system.
be 11. So there are these 11 what? Systems. And all these systems are essential for life. Hey, Regina Sasu. Regina.
Regina, Adriana Ben,
Regina.
how can I say?
Regina. So this one, just mute yourself. I want you to be able to talk. That is why I want you to mute on unmute. If I mute all of you, you will not be able to talk. So Yvonne, you want me to mute? So please just mute. So, okay. So these systems work together ensures they are responsible for these characteristics of life. One of the characteristics of life is organization. Body is well organized, irritability or responsiveness, growth and development, reproduction, movement, hemostasis, metabolism, and adaptation. All these systems working together are responsible for these life processes. I believe the physiology lecture dealt with these things. Two of us.
Yes.
Yeah, she did. She did.
Yes. So for this semester, uh, after after the tissue, after the tissue, we will look at the skeletal system. We look at the muscular system. We look at the cardiovascular system. No, I didn't say cardiovascular. There are also the respiratory system, cardiovascular system, and the lymphatic system. I think some people are very stubborn. I think I have to mute you. Excuse me. So all of you are muted. If you want to, if anything, you raise your hands or you type. I think that will be better. So we'll do the skeletal system, the lymphatic system, excuse me, the respiratory system, and the muscular system. So those are the systems that we'll be doing this semester. Then anatomy 2, we do the other systems. So now let's look at anatomical planes, sections, and anatomical positions. We want uniformity in the study of anatomy. Because if you look at the way, I don't know how you position your body, but I believe that some people are lying on their bed, whether supine or prone position. Maybe someone, I will not be surprised if someone is even is in the washroom. So you realize that there are various ways that someone can position the body. So if you are trying to describe something, it becomes very, very difficult. It becomes very difficult to describe the thing because of the different positions that the person may be in. So anatomists decided that in order to fully describe something that everyone will understand, irrespective of the part of the universe that you are in, we decided to define a position, and that position is what we call anatomical position. And the gentleman here is in the anatomical position. Another position is a reference position used to describe the body structures regardless of the person's actual position. So the person will stand erect with the face forward. The upper limbs will be by the sides, the lower limb together, and sometimes maybe not that together, and the toes pointing forward. So here, look at so here, the palm is facing forward. The palm is facing forward, not backwards. And the person has no dorsiflex or plantar flex. In fact, when you are measuring someone's height, the person is always supposed to be in this anatomical position, but not so like the lower limbs are together and the upper limbs are together. But of course, the position of the head, the person should be stand straight with the face facing forward. So that I can measure from the vectors to the plantar surface. So this is an anatomical position. Of course, for nurses, you know that there are these position, the other positions. Of course, those worth mentioning is the supine position, where looks like you are looking at the sky. Then the prone position, like more position that most people will sleep. The abdomen is on is in contact with the mattress. Then you have the lithotomy position, the position that's when you're doing vaginal delivery, you'll be in. And of course, you know that there are so many positions. Now, as I said, we dissect, you need to cut, you need to make sections. So they are, especially these ones are very, very important when it comes to medical imaging. So their planes are basically imaginally two dimensional flat surfaces, while a section is a slice made along one of these planes. So you have something like the median plane, the median plane. So the median plane, as you know, it will divide the body. Okay, let me use the general terminology. The general terminology is a sagittal plane. So the sagittal plane will divide the body into right and left. The sagittal plane will divide the body into right and left. So this is the right, then that's the left. So this plane, the plane that divide the body into right and left is called a sagittal plane. Now, if the plane passes through the midline of the body, such that it divides the body into two equal halves, then we call it the median plane. We call it the median plane or the mid-sagittal plane. But then if that body into two unequal right and left parts, then you can call it parasagittal plane or paramedian plane. So if you look at it, this plane here, if you look at the plane here, this will be the median plane or the parasagittal plane, because you realize that the left side is bigger than the right side. But this one here going through the midline, divide the body to equal right and left. This will be the median plane or the mid-sagittal plane. Then you can also go divide the body into up and down, superior and inferior. So that will be the transverse plane, horizontal plane, or the cross-sectional plane. Okay. Now, in radiology, when you have they normally use the term axial plane. But axial plane is the same as transverse, horizontal, cross-sectional plane. And an axial plane in radiology, images are viewed as if you are looking from feet towards the head. So look at this one here, this will be anterior, and this side here will be inferior. So depending on the plane, this sagittal plane. You see, you can only see half. If you look at then there's a last plane I will not talk about, where you divide the body into front and back. Front and back. So that will be the coronal plane or the frontal plane. So if you look at here, you want to study the brain. Of course, you have to cut it in section. This one is going through the interhemispheres fissure. So it's dividing the hemisphere equal to right and left. So of course, that will be the median plane. This one is divided into front and back. So that will be a coronal plane. And this one is up and down. So this will be a transverse plane. Then we also have to describe structures relative to one another. So we have what we call directional terms. So they are pair of terms used to describe the location of structures related to the body as a whole or to other structures. So they are paired. So like proximal, then there's distal, there's medial, there's lateral, there's right, there's left, there's superior, there's inferior, there's ventral, and there is posterior. Ventral can also mean anterior, and those are also means posterior. So who can help us? Who can use any of these directional terms? I want someone to use any pair of the directional term. So now I'm going to allow you to be able to unmute. So I've done that. So I want you to be able to use. I'll also be checking the chat session to see whether some people have provided an answer. Okay, so you use any of the paired ones. So I want to know. Yeah, there's distal, there's proximal, there's superior and inferior, but I want you to use it. I want to use it to describe two structures. So that they are used to describe the location of structure relative to the body as a whole or to other structures. Yes? I'm listening. I can't hear you. Oh, someone said that the knee. Okay, let me start with those ones that they type. The head is superior to the neck. Yes, okay. The head is superior to the neck. So superior means up, then inferior means what? Down. So that one is correct. So I think that's how you also have to get it.
The wrist is
then the leg is distal to the head. So that one too makes sense. The ear is lateral to the nose. So this is the nose, this is the ear. So the ear is lateral to the nose. So that one is true. So medial means closer to the midline. Lateral means far away from the midline. Okay. So I think we know these terminologies. Anterior, posterior means front and back. Superior, inferior means up and down. Proximal and distal, we are saying that you use it. Proximal means it's closer to the head region. The distal means it's not just closer to the head region, but also closer to the point of attachment. So you realize that we normally use them with respect to the limbs. So that you can see here the thigh is proximal to the leg. And also means that the leg is distal to the heart, to the thigh. Because if you have more than, if you are richer than me, then of course it means that I'm poorer than you. So we already know these terminologies, so that is fine. There are other two that we need to know. That is ipsilateral and contralateral. Ipsilateral means on the same side of the body as another structure. Contralateral means on the opposite side of the body from another structure. So if you look at the example that they are giving here, the ascending colon is on the right and the descending colon is on the left. They're on the opposite side, so they are contralateral. The gallbladder and ascending colon are on the right side of the body, so we can say that it's ipsilateral. And realize that when we do the nervous system, we are looking at the cerebrum. We get to know that the right hemisphere controls the contralateral side of the body. Of course, I'll use the term. So the right hemisphere will control the left side of the body. So that will be contralateral. If you have cerebellar damage, you realize that if the right cerebellar hemisphere is affected, the effect will be on the right side of the body. So we say that cerebellar damage is ipsilateral. It occurs on the same side of the body. Let's see. Okay. So the next thing is to look at the body regions. So the body is divided into two main regions, the Asia region and the appendicular region. So I think the images that you have here says it all. So there's a head, there's a neck, anatomy, there's also the back. Then we have the trunk. The trunk is basically the thorax, the abdomen, then the pelvis and perineum. So the part covered green is technically that's the perineum. But then you know that there's a pelvic cavity. So we have also the pelvis, if you're looking at the reproductive structures. Then we have the upper limb and the lower limb. So when it comes to anatomy, apart from the learning them by system, you can also learn it by region. And in most anatomy books that are for medical students, it's a regional approach. So there will be a chapter on head and neck. There will be a chapter on the thorax, abdomen, pelvis and perineum, then the limbs. Then we also need to know some few terminologies for the body parts. Let me start with say the upper limb. So your arm is brachium. If you want to use it at or it also means the brachial region. So one is a verb, one is an adjective. So your arm is actually in anatomy, if it's between the shoulder joints and the elbow joint, that is your arm. So you hear something like brachial artery. So when you hear brachial artery, of course, you know that you're looking at what? The arm. Of course, when you're checking blood pressure, it's the brachial artery that you are checking. Then so the forearm is antebrachium. The forearm is antebrachium. This side here is the cubital fossa or antecubital, and we know that that's where we normally would take a venar heart puncture. Your hand is called manus, so manus manicure. Your hand is called manus, so you have the term manicure. Of course, these are Latin words. Your thumb is called pollis. So you have something like, if we have a muscle like extensor pollicis longus, extensor pollicis brevis, flexor pollicis. So your pollis, your thumb is your pollis. Then is the index finger, the middle finger, the little the ring finger, and then the little finger. So these ones are the digits. There is a palmar what surface. So the palmar region, then there's a what? The carpal region or the carpus, because that's your wrist where you have the carpal bones. If you look at the lower extremity, that your thigh is your femoral region, because there is a bone there called femur. So here we have femoral artery, femoral vein, femoral heart nerve. And once you hear that, you know that they are coming here, or you find them in the thigh region. Then your leg, between your knee joint and your ankle joint is your leg. Your leg is called crus. In fact, it's crus. In anatomy, the leg is called crus. The plural of crus is what? Crura. So crus is crura. Okay. And if you want to use it as an adverb, then you say the crura what region. The crura what region. The crura region. Then behind, so this is a patella, the kneecap. And posterior to it, you have the popliteal fossa or the popliteal region. Now, so the artery there is called popliteal artery. The vein there is called popliteal heart vein. Your anantu is your calf is the sural heart region. Your foot is called pedal region of the pes. So you go and do pedicure. So this is the dorsum of the foot. Then this is the what? Plantar surface of the foot. So you have plantar nerves, then you know that, or plantar vessels, then you know that you're looking at here. This is a calcaneal region because the bone here is called calcaneus. Of course, we know the abdomen, we know the navel, we know the inguinal region. Then we know the thoracic region. We know our armpit to be axilla. So we know the ear to be what? The aortic, the external ear to be aortic. So otoscope will be the instrument that will be used to view the external ear. Of course, your buttocks is called the gluteal region. So because you have the muscles there are also called gluteus muscles, gluteus minimum, gluteus medius, and gluteus what? Maximus. So you have the spine here. So the vertebral column or the spine. So these are just some terms that you need to be familiar with. Okay. Concerning the digits of the lower, we have the big toe is called the hallux. The hallux. In an anatomical position, the hallux is medial, but the pollicis is what? Lateral. So you realize that they are it's also in an anatomical position. Okay, your neck is cervical. So you realize that the uterus has a cervix. If the penis has a leg, just like the clitoris also has a leg, crus. So we talk about the crus of the penis, the crus of the clitoris means the leg of these structures. So this is just some parts that you can label. When I'm giving the slides to you, I think I remove this part. It's not necessary. Then the internal body cavity is also We are also going to look at the internal body cavities. Or someone said the spine posterior to the heart. And that one is true. It also means that the heart is anterior to the heart, to the spine. Okay. But I didn't, there's something that as you also said, you can combine two. And I think let me try and use that one. For example, if you look at the eye and the nose, you realize that the eye is superior to the nose, and the eye too is lateral to the nose. So you can say the eye is what? Superolateral to the nose. So you can also combine those terms. Superolateral. Superolateral. So you can say anteromedial. All those things you can use. You can combine them. The most important thing is that it should make sense. The body divided then into cavities. There are two main body cavities. We have the dorsal body cavity and the ventral body cavity. The dorsal body cavity includes the cranial cavity. The important structure there is the brain. The ventral body cavity or the spinal cavity, the important structure there is the spinal cord. The ventral body cavity is divided into thoracic cavity, abdominal cavity, and the pelvic cavity. The thoracic and the abdominal cavity, they are separated by the diaphragm. Separated by the diaphragm. But between the abdominal cavity and the pelvic cavity, we don't have anything separating the two. So we normally put them together and say the abdominopelvic what? Cavity. Excuse me. The organs within the thoracic cavity and abdominopelvic cavities are referred to as viscera. I refer to as viscera. Now I'm going to ask you some questions. I'm going to ask you to tell me some of the things that you can find in the thoracic cavity.
Can find the lungs.
So in the thoracic cavity, what can you find?
The two
Please,
lungs.
you can
the
find
left
the
lung.
sternum.
You can also find the heart.
You can find the
Okay,
sternum.
You can find the liver.
okay.
Lungs.
Let me say something here.
Right.
Every cavity will have a boundary. So if I want to define the boundaries of the thoracic cavity, anteriorly, in fact, I can say anterior. Okay, let me use that. Anteriorly, because this one is more also anterior. So that's why I want to use the anterolaterally so that I can say the ribs, the sternum, and the ribs. Posteriorly, we have the thoracic vertebrae. Inferiorly, there is a what? There's a diaphragm. Superiorly, there's an opening that communicates with the neck. So that one will define the boundary that we are calling the thoracic cavity. So if I want the structure that I can find the thoracic cavity, the sternum cannot be part because the sternum is a boundary of that cavity. The sternum is a boundary of that cavity. For example, if you also look at the abdominal cavity, superiorly, I can talk about the diaphragm. Posteriorly, I can talk about the posterior abdominal wall and the lumbar vertebrae. Anteriorly, I can talk about the anterolateral, I can talk about the anterior abdominal wall. So that one would define the boundary. That one would define the boundary. So we are looking at the contents. The contents. So in that case, for the thorax, you cannot say, someone is saying I've seen lungs, I've seen trachea. So we will leave the sternum. So we have the lungs. Someone is saying the liver. The liver is not there because you see, the reason the liver is not there is that one, I have defined the boundary. The inferior boundary of the thoracic cavity is the diaphragm. The inferior boundary of the thoracic cavity is the diaphragm. The liver will be found here. Your liver will be here. So it's below the diaphragm. and therefore it cannot be in the thoracic cavity. I understand it's protected by the ribs, but then the inferior boundary is the diaphragm. We say the diaphragm separates the thoracic cavity from the abdominal cavity. So in that case, we will not accept that. If you look at this structure, the image here, someone has said that trachea, someone has said the esophagus, the heart, and the lungs. So those ones are in the thoracic cavity. When we do the respiratory system, of course, then once you mention the trachea, you know that you have the bronchi, you have the bronchus, etc. Then there's the abdominal cavity. So within the abdominal cavity, of course, if you look at here, there's nothing separating the abdominal cavity from the thoracic abdominal cavity from the pelvic cavity. So the things that you can find in the abdominal cavity, you can see the liver, you can see the stomach, so gallbladder. So basically the GI tract from the abdominal esophagus. Yeah, there will be part of the esophagus also within the abdomen. We'll call it the abdominal esophagus. And the stomach, the duodenum, the jejunum, the ileum, the appendix, the cecum, the ascending colon, the transverse colon, the descending colon, the gallbladder, the pancreas. You can see the kidneys. We can see the suprarenal gland. We can see the spleen. They are all in the abdominal cavity. You can even talk about the abdominal aorta and the inferior vena cava. All these are, let's stick to the viscera, are within the abdominal cavity. So from what you are seeing now, anything that you can say with respect to the pelvic cavity, what can you see in the pelvic cavity?
The bladder, the urinary bladder.
Bladder.
So the bladder, the urinary bladder,
The uterus.
the uterus. So what is common is to them is the rectum, the urinary bladder. Then you can talk about the pelvic ureter. Now the abdominal ureter is in the abdomen. The pelvic ureter is in the pelvis, pelvic cavity. So now, you can see those ones. So now in the pelvic cavity, someone said ovary. What else? Excuse me.
Fallopian tube.
Fallopian tube.
Prostate gland.
The cervix. Rectum.
So, okay, so when someone says the uterus is fine because the cervix is not something like a separate structure from there. Okay. So what about what about the vagina?
Prostate gland.
I just said it.
I'm asking, is it in the pelvic cavity or is it in the perineum?
Perineum.
It's in the
Hello, sir.
perineum.
The vagina is in the pelvic cavity.
Okay. Now,
It's the vulva that is found in the perineum.
yes, I understand the point that you are making. But then let's also get something here. In the pelvic cavity, the floor is formed by the pelvic diaphragm. I think you know that. There's a muscle. The urinary bladder, the rectum, the ovary, they sit on a muscle. The muscle that forms the floor of the pelvic cavity is called the pelvic diaphragm. So anything about the pelvic diaphragm, I'm connected to online. So I think I can, let me, so let me try and let me try and explain something. So here, I'm talking about this one, pelvic diaphragm. So I can use this image. I think you can all see.
Yes,
Please,
please.
can you see?
Yes, sir. Yes,
So
sir.
this
Yes,
muzzle
please.
here, this muzzle is the muzzle that forms the pelvic floor, the pelvic diaphragm. Uh, okay, this one is not part, and this one too is not part. So it's essentially these ones. The elevator inner and a coccygiosis muscle. So all the structures that are superior to the pelvic diaphragm are in the pelvic viscera. Our pelvic viscera. Our pelvic viscera. So in that case, but then look at it. They are openings. They are openings because if you look at here, the rectum will pierce it and become the inner canal. The vagina will pierce it. Pierce the pelvic diaphragm, then you see it on the outside. The urethra will pierce the pelvic diaphragm. So you realize that, yes, the vagina is in the pelvic cavity. But so as someone said, the vulva, which is the external genitalia, is in the perineum. Of course, the lower part of the vagina. So part of the vagina will also be in the perineum because in the vulva we see the vaginal orifice. So this is the pelvic diaphragm. So structures above the pelvic diaphragm are, superior to the pelvic diaphragm are pelvic viscera. In other words, they are in the pelvic cavity. If you are inferior to the pelvic diaphragm, then that's the perineum. In fact, that's how we define the perineum. The perineum is inferior to the pelvic diaphragm and in between the thighs. So this side here is the perineum. And in future, when we are looking at the perineum, we define it as a triangular area. So the inner canal and the anus will be in the perineum. Your external genitalia will be in the perineum. So here, that's the vagina orifice. So part of the vagina will be in the perineum, but of course the chunk of it is in the pelvic cavity. So we know there's contents within these cavities. In both males and females. In the females, you can talk also of the urinary bladder. Of course, you can talk about the prostate gland. You can talk about the epididymis. You can talk about the seminal vesicle. They are all within the pelvic cavity. Your penis and the scrotum, the testes, are in the perineum. Please, are we okay with the pelvic? I don't know how I have this image here, but I think this one is a laparoscopic view showing the pelvic viscera in females. So you can see the uterus, you can see the fallopian tube, you can see the ovary, the ovarian ligament, you can see the rectum. Then this is the urinary bladder with the pouch of Douglas and the rest. Okay. So that is all that I want to say with respect to the thoracic I want to say about the body cavities, the dorsal body cavity and the ventral body cavities. Now, let me say something here. This diagram, this image, you realize that we are saying that this whole area here is the thorax. And we define the thorax, the bundle of the thorax, to be inferiorly the diaphragm, superiorly communicating with the neck. Anterolaterally, we have the sternum and the ribs. Then posteriorly, we have the thoracic vertebrae. Now, this is the lungs. That space between the lungs, the space between the lungs is referred to as the mediastinum. The space between the lungs is referred to as the mediastinum. So the blue thing that you are seeing is the boundary of the mediastinum. So this is the what? The mediastinum. Okay. Please, once again, when you watch this, okay, I think this is better now. So they've done it nicely. So that's the mediastinum. The space between the lungs or the pleural cavities is called what? The mediastinum. So that one is important. Another point that I want us to note is this. Let me check. Okay, so you can find the heart located in the mediastinum inside the pericardial sac. That's what I'm getting to. So the space where you see the dotted, that is the mediastinum. So what it means is this. You can say that where the hearts are located, you can say that the right lung, where the lungs, the right lungs and the left lung, you can say that they are in the pulmonary cavity. I don't want to use the word pleural cavity because the term pleural cavity can mean two different things. And because of what I want to talk about, let me use the word pulmonary cavity so that it will make sense. So the lungs are in the pulmonary heart cavities. So with the area that we are calling the mediastinum, the esophagus is in the mediastinum. The trachea is in the mediastinum. Then the heart is also in the mediastinum. When we study we do the cardiovascular system, we understand these regions proper. Now, the ventral body cavities, the thoracic cavity, the abdominopelvic cavity, they are lined by a serous membrane. They are lined by a serous membrane. They are lined by a serous membrane called serosa. They are lined by a serous membrane called serosa. They are lined by a serous membrane called serosa. Okay, let me teach it here. Let me teach it here. So there's something that we call serosa or serous membrane. So serous membrane line the wall of the thoracic and the abdominopelvic cavity, and they also cover the organs within them. They also cover the organs within them. Now, so if you look at this image here, this is the thoracic cavity. This is where the lungs is located. So let me say the pulmonary cavity. So there is a serous membrane that lines the thoracic wall and also cover the organs. So that's why we refer to as the serous membrane. The serous membrane produces serous fluid, which reduces friction between organs and the cavity walls. The important serous membranes are the pleura, which is related to the lungs, the peritoneum, which you find in the pelvic cavity, Then the pericardium, of course, we find it in where? The heart. But the serous membrane is one continuous layer, but for the purpose of description, we can identify two areas. So we can liken it to an inflated balloon, then you making a face, pressing it on the balloon. So you see that there will be some of the wall of the balloon will be covering the face. So that one will be the visceral serous membrane. And this part here, which does not have connection to the face, or in other words, the viscera, is the parietal serous membrane. So whether it's pleura or whether it's peritoneum, but it's always like that. So if you look at here, what is investing the lungs is the visceral pleura, and what is lining the wall is the parietal pleura. So this one here is a visceral pleura, and this is a parietal pleura. Now, if you look at the abdomen, what line the wall that they've numbered green, blue, is the parietal pleura, and the one that invests the organs is what we call it's called parietal. But for the abdominal pelvic cavity, we use the word peritoneum. So parietal peritoneum. Then this one will be what? Visceral peritoneum. If it's the heart, the one that covers the heart itself, making the outer layer of the heart is called the visceral pericardium. And the one that lines the wall is called parietal pericardium. Now, with these cavities the cavity will contain the space between the viscera and the parietal. It's called pleural cavity with respect to the lungs, peritoneal cavities, and this one is what? Pericardial cavity. So you see, the heart is not in the pericardial cavity, the lung is not in the pleural cavity, and the abdominal viscera are not in the peritoneal cavity. The cavities only contain small amount of what? Serous fluid. When you have excess of this fluid, as you can see here, in the peritoneal cavity, then we call it ascites. In the pericardial cavity, we call it pericardial effusion. Then in the pleural cavity, we call it pleural effusion. You see, this space that you are seeing here, which appears very white, is the fluid. And this is the lungs. The lungs is filled with air, so it will appear black under the X-ray. So that is that. When we do the what do you call it? The systems proper. When we do the cut, I'll talk about the pericardium. When we do the lungs, I'll talk about the pleura. And when we do the abdominopelvic cavity, we'll also talk about the peritoneum. But it's important for you to note that the ventral body cavities are lined by a serous membrane. And the serous membrane are the pleura, peritoneum, and the serous pericardium. I'm not going to talk about these abdominal quadrant and stuff because I like to talk about them when we do. So this one is not going to come in your exams. So I'll leave it out. When we do the digestive system, then I think we'll learn it. But what is significant that maybe you need to know is that in anatomy, there are imaginary lines, planes, that we use to divide the abdomen into regions, planes that we use to be able to identify what structures. So maybe that is what you need to know here. When we do the digestive system, then we'll look at these ones. So I'll leave them out. Now there's imaging. There's imaging. So this one, so let me do it as an introduction, medical imaging, because this one is now very common. Anytime a patient comes to the hospital, the person may be asked to go and take one of these imaging modality. And the purpose is to the early detection of disease. You can also use it to monitor, and you can also use to guide some interventions. Yes, sometimes, for example, if you have fluid in there's ascites and you want to drain the fluid, if you are not that good, you can do it under the guidance of ultrasound. So some of you will talk about, I will let one or two of you talk about these imaging modalities, but we have the X-ray, we have the magnetic resonance imaging, MRI. The MRI can have the one that use magnetic field and radio wave. You can have magnetic resonance angiography. Angiography means that one purposely for vessels. Then you can have functional MRI. So that one is a special type of an MRI. Then you have the X-ray, you have the conventional X-ray or the plain, they have the computed tomography, you have fluoroscopy, mammography, then bone densitometry. You can have ultrasound-based techniques, Doppler ultrasound or the normal conventional ultrasound. Now, each of these ones, then these specialized intervention techniques like endoscopy, capsule endoscopy, and all these ones. Can someone, maybe the point that I may want to state here is this. Of course, there's a section of ultrasound where they is regarded as safe. The principle when it comes to imaging, they use this principle, ALA principle, as low as reasonable, achievable. So even in ultrasound, although we are saying that ultrasound is safe, Doppler ultrasound can present problems. So, in fact, Doppler ultrasound is only done when the advantage outweighs the disadvantage. And of course, of all these imaging modalities, especially those that has to do with the X-rays, of course, it is done when the advantage outweighs this disadvantage. So I want some of you to pick any of the imaging modality and just say one or two things about it. Yeah, so pleural cavity. Yeah, so the pleural or pericardia or the spaces is the same as cavities. Spaces are the same as cavities. So who is going to help us? You pick any of them. Okay, you let me do it fast. So we are looking at X-ray. X-ray uses what? You know, when you look at the electromagnetic spectrum, there's gamma ray, there's X-ray, there's UV light, and all those things. So there's an X-ray, and it has a short wavelength, so it's very destructive. But then the advantage is that it's quick and it's not very expensive. So we use X-ray to visually dense bones and abnormal dense structures. And abnormal dense structures can be kidney stone, tuberculosis nodules. So you realize that when students have to when you get admission to any institution, you are told to do a chest X-ray. Of course, that one is, in fact, the main thing is to detect what tuberculosis, because it's contagious. Now the teeth, you know that when you go and do to the dentist, sometimes they take these X-rays. So that's what and this is how you get the image. Some part will appear white and some part will appear black. Now, that one is because some of the structures will absorb the X-ray more than what others. So there's a term that we use, radio opacity, the ability to block what? The X-ray. So if you look at air, so this one's from the least to the most radio opaque structures. The more radio opaque will appear what? White. And the less radio opaque will appear gray to what? Black. So air, fats, soft tissues, bone, and metal. So metal will be more radio opaque, so it appear white than bones. The less radio opaque will appear what? Black, and air is less or the least what? Radio what? Opaque. In other words, the X-ray will pass through easily. The one that absorb most of the X-ray will appear what? Black. So if you look at here, there's the lungs. So within the lungs, there are a lot of air, and that's why they appear black. X-ray is able to pass through what? Easily. If you look at here, there's a metal implanted in the person. So if you look at the bones and the metal is more radio opaque than bones. So that one will absorb more of the X-ray. So that one appear whiter than the bone. So that is, and this is how the X-ray can be taken. It can be in the anteroposterior way, or the anteroposterior, posterior anterior or anteroposterior, or it can be in the lateral approach. So here, the thing is from the back to the to the front. Then you can also have fluoroscopy. Fluoroscopy also uses X-ray, but then it's more like you are looking at a video. It's like a recorded video. You see the process. Then you can have mammography. Mammography also uses low doses of X-ray. And of course, for women who have have a history of what do you call it, breast cancer, it's advisable that they do mammography very early, because that one is able to detect it better. Because by the time you feel a lump in the breast, means that the size is big enough. But with mammography, you will detect it very, very early. But these ones use X-ray, and of course, X-rays can cause mutation. So these ones are usually not done, as you know, it's in pregnant people. You can use, there's also one where X-ray is used to check the bone health. So if someone has, let's say, osteoporosis, this one can be done to check that. Then you have CT that also uses X-ray. Then CT, this is CT, takes cross-section. In fact, they used to call it CAT scan, computed ASIA. ASIA to refer that there's a transverse section. So it takes slices. So this one is an image that you can see. The CT is very, very good for to identify soft tissues. soft tissues, and even bone fracture. But of course, it's more expensive than X-ray. Then finally, MRI. MRI uses magnets and also radio wave. So to be something like this, there is a giant magnet. And of course, because it's a giant magnet, if you have any magnetic implants, you can't go through what? You can't do MRI. MRI is very, very good for joints. You can see the tendons was nicely, and also the best for brain and the spinal cord. The good thing is that it doesn't use X-ray, so it's safer. There is a form of MRI called the functional MRI. That one can be used to measure brain activity by detecting changes in blood flow and oxygen level. Now, this one is just a schematic diagram showing how functional MRI is used. Now, in this functional MRI image, they actually took this one from two different people who were driving and at the same time were on a phone. So if you look at A, the posterior cerebrum engaged in driving a car. And in the B, the posterior cerebrum driving and talking on a phone. So here you see that because this one, the person was just driving, and we know that the occipital lobe is where the visual cortex, the primary visual cortex and the secondary visual cortex are located. So the person driving realizes that there's much activity going on, and this one can only be measured using a functional MRI. But the one talking on the phone, you realize that the person also is distracted. So you see that there's less activity in terms of oxygen usage in these neurons in the visual cortex. So you realize that if there's supposed to be an accident, this person is more likely to engage in an accident than this other person. And this one was made possible through functional MRI. It measures the brain activity. Okay. Then you can also use, of course, the popular ones. I have to talk about it before I end the class, and that is what ultrasound, where you sound high frequency sound. In ultrasound, human ear we can hear sound frequency between 20 hertz and 20 kilohertz. So ultrasound means above 20,000 hertz. That means 20 kilohertz, above 20 kilohertz or 20,000 hertz. So you cannot hear, but then the probe that they'll put, the probe will make some, what they call it, make some sound which is not audible to the human ear. There will be absorption and reflection, and can be used to create what? Two-dimensional image. So this one here is a two-dimensional image. 2D, this is one is 3D. And now we know that there's even a 4D, where the 4D is more like a video. Video. This one is a 3D. Of course, you don't need to spend money trying to get a 3D, 4D. The 2D is enough. It's enough. In fact, the rule is that, in fact, this one is clinically, you don't need it. And it's believed that the amount of time that is spent doing 3D and 4D may pose some problem to the fetus. So, as I said, if you are using the ALA principle, in fact, when you are even taking it, there are some medications that they see on the screen that kind of more or less warn them whether they are going there. Because this one, there will be some heat that will be generated. So they check. There are some index that they check on the screen to guide them when they are doing their imaging. Okay. Anything that you want to, that will be free in the wrong place. Change. Please, how will you know an organ is affected after an X-ray or CAT scan? So the thing is that if you look at someone taking off any of these imaging, you realize that they go and hide somewhere. The radiographer will go and hide somewhere, and that will be a lead. So the radiation is just passing. That is, you can't see it with your naked eye. But then when you are exposed, too much exposure, we are saying that can cause what? Mutation. Can cause mutation. So you see that it's not recommended for pregnant women. If a doctor was so insist an X-ray to be done for pregnant women, then as I said, means that the advantages outweigh the disadvantage. But they will not even, because CT dose is, even though it's X-ray, but I think that one is less. But then ultrasound has come to save us, because ultrasound will be able to pinpoint a lot of things. So please say, how do you know there's a problem with an organ after the X-ray? That you don't know. You don't know because you can't see. But those people who are doing it, the physics tells them the amount of radiation that they are using. So the more exposure, the more you are likely to have problems. You are likely to have problems. If you look at, and of course that is one of the reasons some people don't even want energy from nuclear. Nuclear energy is very cheap. People are afraid of the radiation because of what happened in is it Chernobyl or whatever, where there was a disaster at one nuclear plant, and because of that disaster, I think in Russia, no one lives in that town, even up to now. Even up to now. So the doctor will weigh the advantage over the disadvantage. I'm not going to continue. PET scan, I'm not sure it's even done here, but then it's definitely be very expensive. It used to assess metabolic and physiological activity of a structure. So if this one maybe on the brain, the color coding shows where there's a lot of activity. If you look at the black and blue color, indicate minimal activity. So this one is kind of, but this one is a radioactive thing that they actually put inside you. So you have an injection of a same radioactive tracer, and that help detect what disease, what cells. So this one, in fact, when you take it, you yourself become radioactive. But then when the procedure is done, everything will leave you, then you'll be safe. So that's endoscopy, what to call it, laparoscopy, the so-called keyhole surgery. Okay, then you can also have what they call it, interventional radiology, where it uses imaging guidelines. So you are doing a procedure, but then you are using imaging techniques to guide you in the procedure. For example, if you want to do balloon angioplasty, you definitely would need an imaging to guide the physician. So that one falls under interventional radiology, which can be a diagnostic tool or a therapeutic tool. Because you want to play a stent, definitely you need an interventional radiologist to help you. Okay, so about contrast media, because in order to get a contrast, sometimes there's a contrast media that you have to inject, or maybe even through the enema. And this contrast media, some people react to that. And how will you know whether you react? Okay, when they do it and you react, then of course you know. But some people react to these contrast media. It can be through, because if you look at this one here, if you look at this one, how are you going to know that there is actually stenosis in the vessels? Definitely, there's a contrast media that has been passed, so filling the vessel. So when you take the image, you can see the narrowing. So if it's this one is taking what meal, because you need a contrast. As everything will just be basa. You need a contrast to bring the distinct structures out. You see here, there's cancer without a contrast median, everything would have been uniform. You don't have that. You don't need that homogeneous stuff. So the contrast media will bring a contrast and help in the diagnosis. Okay. So this one, you see, they are showing the kidney stone. Thank you very much. The last one, I'm going to talk about it, and that one